Hello and welcome to our Ask Catalyst session. So this is our post-show Facebook Live Q&A. So tonight's episode was all about type 2 diabetes. And we really hope that you felt inspired by watching the stories from Ian and Andrew and Anne. And they certainly showed that just making a few small lifestyle changes really can impact your health. Now, this is really an area of true interest for me because I'm Dr. Joanna McMillan. I'm a nutrition scientist. So I'm joined tonight by a member of my Brains Trust that was an integral part of tonight's episode. This is Associate Professor Sam Hawkins. Sam's an endocrinologist at the Charles Perkins Centre here in Sydney at the Sydney University. So Sam collaborated with me in helping to individualise those programs for our participants. So she is here to answer your questions all about, now not just type 2, you can ask all about type 1 diabetes or gestational diabetes, which I know is affecting quite a lot of you. So Sam, perhaps let's just start by discussing, can you kind of explain to our viewers the difference between type 1 and type 2, because that's quite an important distinction.
Yeah, sure, Jo. So type 1 diabetes is what we used to refer to as juvenile diabetes, but in actual fact, this is an autoimmune disease. So autoimmune diseases are where immune cells attack the body. In this case, it's the cells in the pancreas that make insulin. So people who have type 1 diabetes are unable to produce insulin to regulate blood glucose levels because they don't have the cells in the pancreas anymore that are able to make insulin.
And actually, although it was used to be called juvenile, it can actually be diagnosed as an autoimmune condition throughout life.
At any age, that's right. Yeah. And that's something I think that we've learnt, that it's not just young people who are affected by type 1, that you can get this at any age. And we're able to distinguish whether someone has type 1 or type 2 diabetes by measuring the antibodies in the blood that are suggestive that it is a diagnosis of type 1 diabetes. Now, type 2 diabetes, on the other hand, is also a disorder where you're unable to regulate blood glucose levels and keep them normal in the blood. But in this case, there's an underlying resistance to insulin. So that even though the body is able to make insulin still, it's not able to make enough to keep the blood glucose levels normal.
Or the insulin can be defective. So the insulin's not working as it should be.
Yeah, so in some cases in type 2 diabetes, there are people who also have early beta cell failure. So beta cells are the insulin-producing cells in the pancreas, and they fail to make enough insulin to keep the blood glucose levels normal. So there is a spectrum across type 2 diabetes, some who are more insulin resistant and some who maybe have this more early beta cell failure.
So type 2 diabetes is what's affecting most Australians, and that's really what we were interested in this show, wasn't it?
That's right.
This is the type that really is, diet and lifestyle are so important, both in preventing type 2 and in managing it. So the big question then, Sam, which I think is a question that we've tried to look at, is can you reverse type 2 diabetes?
Yes, so I think there's been some really nice new data that says that yes, you can. And I'd like to tell you about one particular study which has recently been published, which I think is really quite inspirational for people who have been recently diagnosed with type 2 diabetes. It was called the DIRECT study, and it was a study that was done in the United Kingdom, actually within GP practices. So it wasn't done in a big research centre, it was actually done out in the community. Now,
so real life we're talking.
Yeah, well, in the community with your GP. So what they did in this study is they took people who had been diagnosed with diabetes in the last 6 years, and they couldn't be on insulin, but they could be on diabetes medications, and they put them on a meal replacement program where they reduced their caloric intake with the aim being to lose about 15 kilos in body weight. So it was a large weight loss goal. Now, what they found is that a lot of people volunteered for this study, so people were really interested in trying to reverse diabetes and signing up, even though it was this quite strict, low-calorie meal replacement diet. But they were able to show that they were able to reverse diabetes in a large percentage of the participants. And in fact, the more weight people lost, the higher their chance of reverting their diabetes. And about 50% were able to revert their diabetes completely. So go back to having normal glucose levels, not diabetes anymore, without medication.
Which is pretty phenomenal. And that really sort of brings us in, before I hit this question, it really brings us into the fact that weight control is a really key part of what we're talking about here, isn't it?
Yes, when it comes to preventing pre-diabetes progressing to diabetes, and when it comes to remission of diabetes once you have diabetes, losing weight appears to be the most effective strategy.
Yeah. Okay, so and that was one of the interesting things, that one of the reasons I was really happy to have Ian on the show tonight, though, was to show that it's also not just about your total weight, but it's about where you're carrying that body fat. So, you know, we used the in a very nice way, I hope, we called Ian the skinny fat man.
That's right, we did.
But it's that visceral fat, isn't it, Sam, that's so important for people to lose?
Yeah, so it's that central fat, the fat around your middle, and this is where we often refer to people as being apple-shaped, where they carry that weight more centrally. But it's not just under the skin, it's actually deep inside, around the internal organs. That's what we're referring to when we talk about visceral fat.
Yeah.
And that's different to the pear-shaped person who carries more of their weight under their skin in their buttocks and their thighs. And that fat is relatively actually protective against metabolic disease.
Yeah.
Visceral fat, as you mentioned on the show, is pro-inflammatory. It releases inflammatory substances into the blood. It increases insulin resistance. And it's this visceral fat that's associated with a lot of metabolic disease, high blood pressure, abnormal blood lipid levels, diabetes, fatty liver.
Yeah. So girls, stop worrying about your bottom and your thighs. That is not the fat that can actually be protective. So that's a good thing. Let's talk then about what other treatments there are for diabetes. So you're in clinical practice. So share with us what some of the treatments might be if someone has been diagnosed with diabetes.
Sure. So look, underlying all treatment for diabetes is lifestyle modification. So that's the first step. And so that's making sure people are physically active and also eating a healthy and well-balanced diet. Now, I hope that we showed people on the program that you don't have to be a gym junkie, you don't have to be doing extreme forms of physical activity. We're talking about 150 minutes of exercise a week, equivalent to brisk walking. That's the recommendation. On top of that, a healthy diet. Then there are medications that we can use for type 2 diabetes, and there's a number of tablet medications that are available, the commonest of which is metformin, and then there's a number of other medications that can be used in conjunction with metformin. We also have some new injectable therapies that aren't insulin that can actually help by reducing body weight and appetite, as well as controlling blood glucose levels, which are new sort of to the market, and they're really helpful for us as clinicians, for our patients. And then, of course, we have insulin, because we can always replace and lower blood sugars by using the insulin hormone as an injection.
So really important to make sure that you're talking with your doctor about all of the options available. And from a nutrition perspective, what I can encourage you to do is to see a dietitian who's also a diabetes educator. And they are the experts at really helping you to hone your diet to make sure that you're doing all that you can from a diet and lifestyle perspective. Well, this is a really interesting question. Ricardo, thank you for your question. You're asking what percentage of people develop type 2 purely due to their diet?
Yes.
Well, that's a tough question actually to answer, isn't it?
That really is a tough question. I think, Ricardo, you've kind of hit the nail on the head there, because it's not just about diet. It's also about your family history. It's about your racial background. It's about your age, because all of these are really important risk factors, even your gender. Now, some of those things you can't change. You can't change your parents. You can't change your gender or your age. These happen, you know, we all age, and they are major risk factors for diabetes. But on top of that, we do know that lifestyle is an important contributing factor, and that there's this interaction between your underlying genetic risk and your lifestyle. So if you're someone who has a genetic predisposition or a family history, and you also combine that with a suboptimal diet or lifestyle, then you're going to increase your risk.
Yeah, and I think it's worth pointing out, look, it's so easy for these kind of lifestyle-related chronic diseases to end up being, you know, there's the danger of this sort of pointing the finger at personal blame. You know, rest assured that for some people it's much harder to control your weight, for example, based on all of these different factors. And so I think that's really important that we make sure that there isn't this, don't feel that you are to blame. If you've been diagnosed with diabetes, there are lots of different factors at play here. But simply recognise that diet and lifestyle have a role to play.
That's a really important point, Jo, because I think a lot of people don't realise that about 70% of our body weight is regulated by our genes.
For sure, and all sorts of other aspects. You know, we've explored here in Catalyst the microbiome aspect, for example. So so do have, and the second part of that question was about, is it directly related to sugar in the diet? So I feel very strongly that we need to get that message across, that that's a very simplistic message. It is not that sugar causes diabetes, and that's a very gross misunderstanding, which is not me defending sugar, not at all. We absolutely know that we have too much added sugar in the diet, but it's actually about too much processed food, too many calories or kilojoules, and not just about sugar. So it's really about the overall, the dietary patterns of the foods that we're consuming, rather than trying to blame any one single aspect of sugar. So we've got, here's a question, how does diabetes cause vision loss?
Yes, so diabetes causes a number of complications, and vision loss is what we refer to as one of the microvascular complications of diabetes. Now that sounds a bit technical. What that really means is we're talking about the small vessels. So there's small vessels that are in the back of our eye, there's small vessels that are in our kidneys, and there's small vessels that actually supply blood to our nerves. And we know that diabetes actually affects these little blood vessels and can cause them to block off. And as a result, we get damage to structures such as the retina at the back of our eyes, which can threaten vision. We get damage to our kidneys, which can end up leading to protein in the urine and then lead on to renal or kidney failure. And we can also get damage to the nerves affecting our feet, which is why people with diabetes can go on to get numbness, and unfortunately that can progress at times to ulceration and amputation.
Yeah. So really what the message there is about, it's really important to control your blood glucose levels. If you've been diagnosed with diabetes, it's those chronically high, elevated, and spikes in blood glucose that's causing this damage to these little capillaries around the body.
Yeah, and I mean, it's interesting, Joe, because it's not just controlling blood sugar. So we know for preventing the complications of diabetes, we really have to take in a multifactorial approach. So we need to control blood pressure, we need to control blood cholesterol, and we need to control blood sugar. Yeah. We need to remove things like smoking, because all of those things are risk factors for vascular disease. Yeah. Some of them more for macrovascular disease, some of them more related to those microvascular complications, but it's that complete picture. So you can't just focus on one thing with diabetes. It's a complex disease, and we've got to target all the risks so we can optimise health.
And actually that's an important point to make, Sam, isn't it? That if you have diabetes, you're also at a higher risk of heart disease. So you really need to be on top of all of those risk factors for everything.
Absolutely. And we know that if we just treat blood glucose, we probably don't have much of an impact on heart disease, that those other factors, blood pressure, stopping smoking, treating lipids, are just as important, maybe even more important than treating the blood sugar. It's that complete picture that's really important.
Lindsay, thank you for your question here on Facebook. So Lindsay asks, is there any point in pursuing research on using stem cells to treat or cure type 1 or even type 2?
Yeah, so Lindsay, that's a really, really good question. I think that is the future potentially for something like type 1 diabetes, but that's still a fair way off, I think. I mean, obviously, if you have a deficiency in a cell type that doesn't produce insulin, being able to replace that cell type with a cell that can produce insulin, it seems like such a simple and easy solution. It's just in practice it's so much harder, because it has to be done in a glucose dependent way. There's no point putting in a little pump that just releases insulin all the time, because it could release it inappropriately when blood glucose is low and cause problems. So getting it to act like a beta cell, which is a really clever cell that is able to say, oh, glucose is at this level, I'll make this much insulin, or now it's dropped, or I'll switch off. That's actually a harder thing to do than we might think, just, you know, plugging in a stem cell that can do the work. I think for type 1 diabetes, it's technology that's really coming to play now as a really good solution for people with making their life easier, living with diabetes day to day. And we were talking before actually about insulin pumps and glucose sensors and this new technology that's almost becoming that artificial pancreas, and that may be the first thing that comes rather than something like stem cell therapies. But I think we have to watch this space for the exciting future that's to come.
But I think that's reassuring, particularly for the parents out there who have children who've been diagnosed with type 1, then these kind of technologies are going to make life so much easier.
Yes, and it's really interesting, Joe, because I think in my clinical practice, I'm not seeing the complications from type 1 diabetes in my younger patients that I have seen or used to see in some of my older patients, and I think that's just because we do have better insulin, we've got a better monitoring, we've got better technology, and all of these things are really changing the way type 1 diabetes is managing, and it's becoming a much brighter future.
Yeah, so be reassured if you're dealing with it in your family. Daniel is asking, that's a great question, Daniel, does sitting down for long periods of time contribute to the risk of diabetes?
Now that's you might want to answer this question too, Joe. So this is that whole idea of, you know, sedentary time versus standing time, and should we be having walking meetings and standing desks? look, I think anything that introduces more physical activity into your day is a really good thing. I mean, we know that our leisure time now is spent more with screens, in sedentary activities rather than being out and about, out in the fresh air, out exercising. Our work life is also more sedentary than it used to be. And all of these things are contributing to the increasing rates of overweight and obesity in our population, which now affects 63% of the Australian adult population being overweight or obese. So yes, I think anything that keeps people moving, that can burn some extra calories or kilojoules, is a good thing.
For sure. Well, what I can add to that is that there is now research showing that if you're sitting for more than 8 hours a day, which sounds like, oh, surely I don't sit for 8 hours a day. But when you add up the amount of time that we spend sitting in your car or on the bus or the train to work, or sitting at home on the sofa, sitting in a restaurant, sitting at the dinner table, sitting watching TV, sitting playing a game, whatever it might be, it's very easy for those 8 hours to add up. And we now know that sitting more than 8 hours a day is an independent risk factor for all sorts of chronic diseases. So I think this kind of things that Sam was talking about, being able to break up your sitting throughout the day, standing when you can stand, stand on the bus or the train, walking workstations I think are a great idea, so you can alternate between sitting and standing through the day. And yes, certainly that's a strategy I've tried to adopt, is if I have to have a meeting with someone where we don't need paperwork or PowerPoint slides in front of us, then I suggest, why don't you meet me for a walk? And it's great for brainstorming, really good for getting your brain working. So thank you for that question. Okay, so Sam, why does reducing visceral fat reduce the risk of diabetes? So what is it about this internal fat that's so dangerous?
Yeah, so visceral fat seems to be quite different fat to subcutaneous fat. We know it releases different amounts of hormones from fat, which we call adipokines. And some of the ones that come from visceral fat just are bad for our metabolism. They increase insulin resistance. They also are more prone to releasing fatty acids into the blood, so they're a bit more lipolytic, we call that, than subcutaneous fat cells. Yeah. It may also be where they are in our body, because where our visceral fat is deep inside around our internal organs, when it releases these substances, they go straight to our liver. And so it may even be the location of where it is that's important to make them a risk for our health. So it's all those things, the different nature of the actual cells themselves, the fact that they release these inflammatory substances which aren't good for us, the fact that they communicate directly with our liver, all these things add up to make them bad for our metabolism.
And I think perhaps what's worth adding to that is the other thing that, and we saw this clearly with Ian on the show tonight, is that having really well-functioning muscle is very, very important. So because muscle is the major uptaker of glucose from your blood. So it was really interesting, wasn't it, Sam, that we saw Ian have such great gains, not just because he lost visceral fat, but he'd also gained some skeletal muscle. He was doing a really good strength training program.
Yeah, I mean, look, Ian, I was so impressed with Ian's results, and I'm so happy for Ian that all that effort that he put in caused those results. I mean, this was all about preventing diabetes for people who had pre-diabetes. It wasn't really about reversing pre-diabetes and going back to normal, and yet that's what Ian did. Yeah. So, I mean, he really had such a phenomenal response, which I don't think we could have predicted at the beginning of designing the program, and I'm so happy for him. And yes, you're right, he reduced his visceral fat, he became much more physically active than he was before. He even installed his own gym in the garage. I mean, he really went for it, and the results paid off for him. I'm so pleased for Ian.
Yeah. Ella has asked a question: how does insulin resistance occur, and then what happens throughout the body when a person becomes insulin resistant?
Yeah, so look, that's actually quite a complicated question, Ella. So insulin resistance can be caused by sort of a number of things. So one of the things that might be is that we get fat deposited in places where they shouldn't be, so ectopic fat in muscle and in liver. Effectively, what being insulin resistant means is that you need to produce higher levels of insulin from your pancreas to maintain your blood glucose levels within the normal range. So that rather than having your insulin levels at a relatively low level to keep your blood glucose normal, say in the fasting state, you need a higher level of insulin to keep the blood glucose at that same level. And actually having too much insulin in the blood may be contributing to some of the damage that happens with diabetes, like stiffening of arteries and things like that. So it's that idea of needing too much insulin to maintain glucose at the normal range because the tissues aren't as responsive to insulin as they used to be. And then that hyperinsulinemia, high levels of insulin in the blood, also contributing to the problem, as well as the fact that, as you mentioned in the program, Jo, glucose levels fluctuate a little bit more with meals. They go a little bit higher, and we know that higher glucose levels in the blood are also bad in terms of complications from diabetes.
And that's again where your diet comes into play here, because depending on the foods that you eat, you can help your body to control blood glucose levels, or you can be eating the types of foods that I showed very clearly with my little experiment with my high GI toast compared to the low GI, that you have a difference in the glucose spikes that you have after a meal based on our food choices. And that's why it's so important that we stop eating so many refined and processed foods, instead of turning to more of those whole foods, whole grains and legumes and things that really help our bodies to control our blood glucose levels. I think some of the most interesting research I've seen over the last year or so is the research showing that even your gut bugs, so the microbiome, is in fact also having an impact on your ability to control your blood glucose levels and your blood cholesterol levels. So we're starting to see that there's a bigger picture here too, and it's tying in very nicely why we know that very high fibre, high plant-rich diets are really, really beneficial for us. Kate Eddy, thank you for your question. You're asking, obviously, alcohol is not great. So talk to us about the impact of alcohol, Sam, on both diabetes risk and managing your diabetes.
Sure. So they're two quite distinct questions there, Jo, actually. So in terms of the impact on, say, developing diabetes, so alcohol is a source of calories or kilojoules, and a lot of people probably don't really think that. So when you're drinking alcohol, you're actually drinking calories. So it's not a calorie-free drink like water. It actually does increase weight. So that's one of the things that it does. We also know it's bad for your liver if we have too much.
Of course.
And so they're the sort of bad things in terms of putting on weight. It's also not great for your liver. Safe level of drinking is what recommended. So that's sort of in terms of developing diabetes, I guess, per se. It's more of its contribution to putting on weight than a direct effect on blood sugar per se. A lot of alcoholic beverages actually don't contain carbohydrates. So when we're looking at things like spirits or wine, they have relatively low amounts of carbohydrate, but something like beer has more.
Yes.
So when we're talking about the impact of alcohol on someone who actually already has diabetes, whether that alcohol contains carbohydrate or not will change whether it increases blood glucose levels or not. The tricky thing with alcohol is, and one of the simplest ways, and it's a very simplistic way of thinking about it, is overnight when we sleep, our blood glucose levels are actually regulated by our liver. So our liver actually makes blood glucose so that we don't become low in blood glucose or hypoglycemic overnight while we're asleep and we're not eating. Now, if you have an alcoholic drink at night, your liver's also got to deal with the alcohol, and it kind of can't do both things at once. So it can't process the alcohol and make the blood glucose at the same time. So people who've got diabetes and are on therapy for their diabetes who drink alcohol at night sometimes can experience overnight drops in blood glucose or overnight hypoglycemia because of this effect of alcohol on the liver. So it can be a bit tricky to manage for people, particularly for people who have type 1 diabetes, that mixture of being on insulin, because they have to be on insulin, and then having alcohol. It can be a tricky thing to manage, actually, because you can get these unexpected drops in blood glucose level overnight. So alcohol and diabetes don't necessarily mix together so well.
You have to be very, very careful.
Yeah. And I mean, certainly if this is something someone's struggling with, it's really important that they talk to their diabetes educator or their GP about how to manage alcohol consumption around their insulin dosing, because it can be quite tricky.
And it might also explain why lots of people are turning to, big breakfasts and fry-ups or very sugary foods the next day after drinking too much alcohol. So be aware of the impact alcohol has on the types of foods that you're choosing to eat too. So it really isn't your friend.
To be honest,
for
Jo,
health.
sometimes if we've got some of our younger people with type 1 diabetes where alcohol's in their social mix, sometimes we actually encourage the consumption of fatty foods before they go to bed at night, because you get that lovely low GI effect and you get the nice release of carbohydrates through the evening to keep them safe.
Yes.
So sometimes actually I have to say I do encourage my patients at times, in very special circumstances, to have a bit of those fatty or carby meals.
Yes, well, you've got to prevent the hypos. That becomes the key message. Okay, so Penny Sam is asking you, what's the one take-home message you'd like people to take home from this programme?
Okay, so I think there are a number of take-home messages, if I'm allowed to have more than one.
Yes,
so
you can.
The first was, I think it's really important to know your risk. And I think we saw that at the beginning of the show, when people were going to Picton, to the community centre there, just to find out. They were a little bit concerned, but they obviously hadn't taken that step necessarily of finding out whether they were at risk and exactly what their risk was. So I think
now our viewers can do that online, can't they? They can do that risk assessment themselves.
Yes.
Online.
So you will have noticed at the beginning of the program they were being asked questions about, what's your age, what's your waist circumference, do you eat vegetables every day? So that's something that's called the AusD Risk score. So it's AusD Risk, and if you type that into Google, you can be taken to an interactive questionnaire that basically will give you a risk score of diabetes. So it takes into account things like your age, your family history, whether you're of an Aboriginal Torres Strait Islander descent, your waist circumference, your lifestyle choices, and that will give you a risk for diabetes. And I think knowing your risk means you can do something about it. If you don't know that you're at risk and you don't know what to do. So I think that's the first message. I think the second message is that simple changes, even though they may be hard to sustain long term, can result in a massive effect. And I think we saw that beautifully with our participants, with Ian and Anne and Andrew. Sometimes it was just switching. I mean, Andrew's breakfast, for example, going from the meat pie to the healthier wrap for breakfast. I mean, not a difficult decision necessarily, from the same shop. He didn't have to change much of his routine, but it made a real difference. So I think just making those simple, small lifestyle changes can add up to a bigger result in the long run. So diabetes is preventable.
And to me, I think that's a really key message for everyone to understand that, a lot of, over my years of being a dietitian, trying to help people to lose weight. Often people have their eye on the end prize. They have their idea of what's their ideal body weight, whatever that may be. We could debate on that all night. And then they feel like they've failed if they haven't got there. A really important message from these big diabetes prevention programs around the world are that was just 5% of body weight shown to make such a dramatic difference to health. And that's important, isn't it, Sam? Because that's more achievable.
I think that's right. And Jo, it's not even that. I mean, the study that we based this intervention on was called the Diabetes Prevention Program, which was the US-based study. Now, in that study, they tried to get people to lose 7% of their body weight. Now, what's amazing is that only 50% of people actually managed to do that. But even though only half of them achieved the weight loss goal, the reduction in progression to diabetes was a massive 60%. So even if you try to lose 7% but don't get there, you seem to still get that benefit. So it's making the changes, it's changing the diet, it's being more physically active. Even if the numbers on the scales aren't the numbers that you wanted, the fact that you've put that effort in and tried could well reduce your risk.
And actually that's crucial too. If you're struggling to lose weight, also, one, recognise there's lots of different ways that you can lose weight. The second thing for me is also put your focus on health, and actually just being more active and eating better gives you improvements, even if the scale doesn't weight and even if your waist circumference doesn't change. And that's a really, really key message, so that we take the focus off weight a little bit. And actually from behind the scenes, the intervention for our participants, I was not giving them kilojoule restrictions. They weren't on calorie controlled diets. Actually, I just talked to them about how to have healthier eating. And so I think that's a really, really important message too. Okay, we've got a last question here from Mars. Thank you for your question, Mars. How does one test visceral fat? Great question. We can talk about what we did in the show.
Yeah, so look, visceral fat, being that internal fat, is a little bit difficult to measure at home, but a surrogate is waist circumference. So if anybody's got a tape measure at home that's flexible, you can get that out and measure around your waist. And we talk about risky waist measurements. So greater than 94 centimetres for a man, greater than 80 centimetres for a woman, does tell you that you're carrying your fat centrally. Now, yes, that will be a mixture of subcutaneous fat and visceral fat, but it's a good indicator. Waist to hip ratio or waist to height ratio are other ratios that we can use. To actually measure it as a gold standard, we can use imaging like CT scan or MRI. In the program, we use DEXA, which gives a sort of surrogate measure of visceral fat, which quite nicely correlates with those other more gold standard measures. But yes, a bit difficult to do an MRI on yourself at home to measure visceral fat, but waist circumference is a good indication. And I mean, if you don't even have a tape measure, if you're knowing that your belt size is going out or that your pants are needing to be a bigger size, then that's a bit of an indication that you're beginning to carry weight around the centre, which is where that visceral fat can be.
And people can go and get a DEXA scan. So the scanning that we were doing on the programme is accessible. You know, it does have to be paid for. It can be a little bit expensive, but it is a measure you can go and get if you're really interested. But yeah, I love the waist circumference is such a good measure, and it really does give you a good indication. Well, thank you everyone so much for joining us tonight. I'm afraid that's all we do have time for. Fantastic questions. We could chat all night on this topic. It is such an important topic, and I hope you really got something out of that. Thank you, Sam, for joining me tonight. Catalyst continues on Tuesdays at 8:30 on ABC, and of course you can do catch up on ABC iView. So next week's episode is Lily Serna with Maths and Probability. Thank you so much for joining us. Goodbye.